Good evening. Since 2025, MD final exams are ongoing. Theory is about to over probably by tomorrow, and by Monday. Subsequently, the students have to face the practical exam. In the practical exam day, after the case presentation in the afternoon, you will be having quarters or some in some institute they say as OSPI or OSCE, whatever it is. So there will be four stations usually for the MD final exam. One is drugs, another one is ECG, third one is imaging, fourth one is instrument. So these are all the four stations. One by one the students have to go and answer, or many a times it might be displayed in the slide form also. Many institutes they might combine ECG and imaging together, and the fourth station might be a grand viva one. So these kind of the structured examination might be there in the afternoon, which might be carrying a significant amount of marks. So since one of our student requested, sir, so some spot as how it can be, what are the questions can be asked. In the institutes where it is in the slide format, probably you might encounter the slides, a few example slides I have kept. You can go through that. And in some institute, it might be like the examiner in person might be asking the question after identifying the particular drug, ECG or instrument, whatever it is. So here there are many set of spotters I'm having around 8 to 10. So I will upload all the sets one by one. So this is the first set of spotter. You can go through the question and answer it. See, this is intended for the MD final exam goers 2025 batch. So though for a MBBS final year ये समझ नहीं आएगा. And non-allied MD नहीं है कुछ और है, don't ask any question in the comment. So if you are a MD final year resident, obviously you know what is the question, what is the videos for. For the MBBS, it is really high level question. For a DM student, probably it might not be related to them. So intended students see and try to find the answer with your friends. If you doesn't know the answer, just text me in the WhatsApp. And then intended students, I hope they are having my number. To text me, I will send you the answer. What is this? So the questions might be like this: finding ECG diagnosis. What are all the causes? So we'll change to the next slide every 30 seconds. Many times I might ask you to read the ECG. You have to tell the rate, rhythm, those things, and the important finding. Look at these things, and the question is, what are the causes? We will go to the second one. What is a blood smear? What are all the findings in the peripheral blood smear? What is the differential diagnosis? I hope you got it. Just to focus over this. Since the second part of question differential diagnosis, you can easily make the diagnosis, since many a student might get confused. Should I focus on WBC? Should I focus on the RBC? In the exam tension only you will forget. So just to focus on the second question, they are asking for DD. Look at the RBCs, you will get the DD. It is not normal colored, it is low colored, hypochromic, looking like microcytes. I hope you got the DD. Another easy expected question, unilateral whiteout lung. I might ask you to read the X-ray if it is a in-person examiner is asking the question. So look at the findings over here. Look at the lung field. Look at the lung fields over here. The trachea is pulled up. Then the question over here is, what is the finding? What are the differential diagnosis? The examiner might ask you to read out the X-ray. The follow-up question might be how to see the positioning of the X-ray, how to say whether adequate penetration is there or not, when to say cardiomegaly. These kind of the usual question might be expected. Next, NCCT brain. What is the specific finding shown over there? What are the causes? What is the treatment? So focus over this area. It's not the contrast, it is NCCT brain. I hope you got the diagnosis. Whitish thing is all over the circle of Ellis. So what it could be? This is the finding. Focus over the side. The follow-up question related to this might be they might ask what is the time duration for an infract, what is the best investigation of choice to if for an infract to be picked up at an earlier stage, which imaging, and what is the difference between MRI and CT. Probably you will be given the film, entire film. Probably you have to say. They might ask the question related to bleed, infract. Probably they might ask you the choroid plexus calcification, the famous landmark one. I hope you will able to identify those. So here the questions are what is the causes and what is the treatment. Fifth one, instrument. Identify this device, complication of the procedure while doing it. Device though you might have easily identified. What are the complication of the procedure? So the follow-up question related to this might be how many LP you might have did during your MD. A common question you can expect from the examiner. And CSF normal values, values in bacterial meningitis, values in TB meningitis. What is the normal intracranial pressure? So what will you do if there is a abscess or some infection at the particular LP site? This might be some common question related to that. Apart from this, complication you should know. Sixth one, identify this pathogen. Name some other test to detect this organism. I hope final MD might be knowing the answer. It's a fungi. Pathogen might be easy. Other test is common in HIV patient is the other clue. What are the other tests to detect this organism? Okay, some more time you can go through the slide. In the drug station, commonly insulin, adrenaline, noradrenaline, dopamine, dobutamine might be kept. So here they might be asking the clinical indication and the doses of a particular drug. Here it is written residronate, it's the bisphosphonates. What is the precaution while taking this drug? Any bisphosphonates have to be taken in a sitting position or a upright position, otherwise it might cause esophageal necrosis. So this is one main precaution, and one more is there. Try to find out, or you might be already knowing. What is the clinical indication and the dosage? Dosage probably many might not be aware. All 10 out of 10 might not be easy. You might get one or two kind of somewhat medium difficulty level questions might be there. For example, they're asking the dose of residronate. Since it is a slide format, more of DNB kind of spotter. So at the time, if you know the dosage, you'll learn good. So again, another drug. What is the mechanism of action of this liraglutide? Dosage and route of administration. Go through this. Drug name is given. If you want to know the answer, just try to find out before your exam day. Another interesting finding. I hope image taken from the Harrison or this image you might have encountered previously. What is the clinical and radiological finding? Look at the findings over here, findings over here, over here, over here. What is the diagnosis? Direct question, clinical and radiological finding. Nail, focus on the bones in the X-ray. The clue is skin might also be involved. That is the clue. We will go to the next one. Definitely, there will be some question related to the mathematical calculation. Either the sodium, which is most common, osmolarity, osmolarity of formula. You might have to calculate it fast. ABG related stuff, Fanian gap, these kind of questions are expected in the station. So here in this example, they have given on diabetic ketoacidosis, they are asking for the formula to calculate the serum osmolarity and what is the normal value. What has caused the change in the serum osmolarity? So these kind of some calculation related questions might be there. So to answer this, at least you should write down all the formulas in a single paper related to sodium, blood osmolarity calculation, intracranial bleed volume, what is the formula, those things you write it in a paper or notebook just before the practical day. Go through it once, otherwise definitely there is a chance you might forget. So this completes the first set of spotter. I hope at least out of 10 you are knowing answer for 8 or 9. If any doubt, you just text me. And next set I will try to either upload or I will send through email to the juniors. So this completes the 10 set spotters. Bye.